Hi everyone, happy Canada Day. Today I'd like to highlight for you the experience at the CHSLDs. It is not a necessarily happy story that I have for you. It is one of tragedy, it is one of loss, but it is one where a community came together and really took care of our elderly population and took care of each other. On April 21st, I started my first shift at the CHSLD and it went on till about May the 1st, which was my last shift. I was deployed to two different CHSLDs where I volunteered to help. I was mostly doing the role of infection control, in which we implemented front door screening for all staff coming in to ensure that they did not have symptoms of COVID. And if they did, they were sent home in order to limit the transmission of the illness. We as well implemented social distancing measures. We put a bunch of X's on the floor to show people what 2 meters looked like. There was a lot of education that was done and that kind of thing. In terms of the experience itself, it was very humbling. It is like nothing I have ever done before or experienced before. People were very, very sick. People were dying. 4 to 5 people a day. It was very difficult to see. I myself had a grandmother who passed away due to COVID at the CHSLD. That was on May the 11th at 89 years old. I was on quarantine at home, having left from one of the CHSLDs, and I did not get to say goodbye. I am not the only one. There are many family members who did not get to say goodbye to their family due to this situation with the COVID and not being able to visit. It was very lonely for them. A lot of them did not have anybody with them in their last hours. And this is the reality of what happened. It was very sad. It was very painful. A lot of us who were deployed there saw things that we should have never seen. Patients were not in the greatest condition. They sometimes were not fed. They sometimes were not changed. And it was difficult. It was very hard to see that kind of thing on arrival. As the weeks went on, things did get better. We got more staff. More volunteers came to help. The conditions improved. Unfortunately, when the help arrived, it was too late for several people already who had passed away. However, we did our best while we were there. Everyone really tried to help, tried to do whatever they could. People took on non-traditional roles. I myself, as a nurse, went in thinking I was going to be doing nursing tasks. In the end, you just do whatever you have to do. We took on roles of housekeepers because a lot of the housekeepers would come in. They would be scared of catching COVID and they would leave after midday. And there would be nobody to clean up patients' rooms and to help in that sense. So several of us took on that role. Sometimes we didn't have PABs. People from different disciplines took on that role. We had physios, we had language therapists, a whole bunch of people who just took on whatever role they had to just to ensure that the patient's basic needs were being met. It was a very difficult experience for all of us. But what got us through every single day was the fact that we were all in it together. We had people that were deployed from the neuro, people that were deployed from the Montreal Children's Hospital. None of us had ever worked a day of our lives at a CHSLD. But we were all there for a common cause, being to take care of the residents who were there to the best of our ability. It wasn't perfect. We went home many days feeling like we failed our elderly. But we did our best under the circumstances that we had. And we helped each other and supported each other through this difficult time. There was also an outpour from the community. We had a lot of volunteers in the community who came in and gave a hand. We had the Red Cross who came in to help. We had the Army who also came in to help. We had people from various hospitals coming in and giving their time as well to help. We had people that had nothing to do with the medical field who were showing up at the door and just asking, what can we do? Can we come in and help? Which was really nice to see. We had people that were donating materials. I remember one day having posted on social media that a lot of us had our ears that were breaking down and trying to find tips of, ways we can have them prevented from breaking down. And one of the nurses that I work with, actually, her mother made a ton of headbands with little buttons, and you can kind of put the mask straps around it, which really helped our ears. And then I had another person who I don't even know who this person is, and he said, you know what, let me know how I can help. I have a 3D printer. I can print you a whole bunch of ear protectors. Just give me a number, tell me how many you need. And it was like, okay, I was willing to pay for this, to help people out. And he was like, no, totally free, anything I can do to help. And it was just amazing. And people really appreciated that when we were handing it out to the staff. They were so happy because it was so difficult. They had visors that they had to wear their entire shift. So basically picture, the summer's coming, it's getting quite hot now, and you have to wear a pair of gloves, you have to wear a gown, you have to wear your visor, you have to wear a mask. And you're wearing this pretty much for your entire shift. It's hot, you're already exhausted, you're sweating, you are having difficulty breathing because you're wearing this mask all day long. You're afraid to remove it because you're not sure if you're going to catch COVID or not. There's this real fear all around you that everyone is going to get sick. You don't know tomorrow if your partner is going to be coming in or not because they might catch it. The supplies sometimes were not adequate. We had gloves that were ripping. They were not good gloves. I know that on one shift in particular, I remember coming in on my first day at the second CHSLD that I was at, and we were being provided super thin gloves, and they didn't have our size. And they were ripping. They ripped about maybe 3 times within an hour that I was there. And you just had to go quickly wash your hands, and it was scary because you didn't know, is this gonna be the reason why I catch COVID because my gloves just ripped. And everyone kind of had this fear. You didn't really know in the beginning what is a clean zone, what is a contaminated zone, am I safe, can I take off my personal protective equipment, am I gonna be okay here? Can I eat here? Did the person before me clean this space? Are we gonna run out of personal protective equipment? Are we going to run out of cleaning equipment? Is housekeeping coming in today? Are they gonna leave at halfway through the day? I mean, these were all things that on a daily basis were kind of popping into our heads, and it was scary, not knowing what was gonna happen from day to day. But as I said, everyone just kept showing up. If they were sick, obviously they didn't come. But for every sick person, we tried to get another replacement. People were working hard behind the scenes trying to staff the CHSLDs. And we just basically, as I said, did our best and tried to take care of these people as best as we could. It was not perfect. It was, if I would describe it, it would be almost like a war zone where you're just trying to survive. You're really in survival mode and just trying to get through your shift and just trying to keep everybody as safe as possible. And that was basically the experience. There's a lot of Canadians across Canada that really stepped up to the plate. As I said, the Red Cross, the Canadian Army, healthcare workers, non-healthcare workers, we really came together. And I think although it was a little bit late when we started to step in and help, we hopefully made a difference for the future of our elderly and the future of those people who will be admitted into those homes. And the conditions hopefully will improve. And we're hoping that there won't be a second wave. And if there is, that it will be very minimal and that we are now prepared to face that. I have faith that we did quite a bit, and in having done that, we will be prepared for anything that comes to us now. And that's about it. That was the experience. Thank you.